Well, disaster doesn't ask for permission. It strikes when we least expect it. And when it does, those in the medical field must be ready for the intense, high-pressure environment that comes with it. 5 News reporter Jacob Luthi takes us inside how local nursing students are preparing for these life or death situations with hands-on training.
I need you to prepare stable patients for discharge and prepare for the first wave of victims to arrive here shortly.
An explosion has gone off at a nearby building.
Okay, no problem. And we're gonna take you downstairs.
That's what John Brown and Harding University nursing students were told as part of their mock mass casualty training simulation on Friday.
They might not ever see one in real life, but the chances are that they probably will. There's a good percentage of nurses that see it in some sort of way or another. There's not a lot of schools that do something like this, so we're really excited to be partnering with John Brown University to do this and give our students that immersive learning environment.
John Brown University's health education building quickly morphed into a bustling hospital of emergency and operating room personnel working together. Harding nursing professor Allison Rushing says the around 80 students from both schools work to prioritize patients according to the severity of their condition, assess them, and assign them to relevant areas in the hospital.
I'm glad that we get the opportunity to kind of experience this because I definitely feel like it's not something that we're going to get to see every day. So just being able to be put in a position of pressure and like learning how to do everything probably will make us feel a lot more confident if the situation was to ever arise.
Despite knowing it was a simulation, nursing student Haley Blake says it still felt very real.
I definitely think everyone's taking it pretty seriously, especially because we're all a little bit nervous because we don't really know what to expect.
Rushing adds it's important for nurses to remember their training when disaster strikes.
Really important that we stick to our roots there and that we make sure that we're following your education. They know what they're doing. They've had lots of training on this. So we're just making sure that they can, when push comes to shove, they're able to do it.
In Siloam Springs, covering news where you live, Jacob Luthi, 5 News.